Hello and welcome to January. Can you believe it's still kind of January outside? Um, we have made it through some snow and some winter and then also warmer temperatures. Really wild out there. But we are here to bring you an informative health video from our friends and partners at Next Level. And they are going to talk about what they are seeing in clinic because as the temperatures kind of do this wonky thing, there's a lot going on too, with our kids and our families and sickness. And we're going to find out what they're seeing in clinic and then how we can hopefully help keep ourselves out of the clinic and what to do if you think you're getting sick. So you've seen her here before. Dr. Shalini Thomas is here with us. She is with Next Level and she covers the Katy and then the central areas of Next Level. Dr. Thomas, great to see you.
Great to see you. I'm so happy to be here again to talk to all the Houston moms out there.
Yes, we appreciate you. And I know you are a mom of three, 6 and under, right?
I sure am. Yes. 6, 4, and 2.
Oh my goodness. And so how they do during the freeze? Did we survive all the things?
I have survived is all I'll say. Yes, I survived it.
We've lived to tell the tale.
Yes, exactly. That's the most important part.
So we had a different topic in mind for today, but then
Mhm.
you told me that you are seeing something a little more prevalent in the clinic. So what is happening at Next Level right now?
So we thought typically the flu season starts around September. So this year, we didn't get as much flu as we had expected in September, October, November, but it's hitting right now. So this week alone, I think I had 5 employees that had the flu and had to go home because of the flu. So it's out there, the flu. So if you haven't gotten your flu shot yet, go get it because it's coming for us. It'll probably extend into the next month as well.
So that's a little bit like daunting because maybe we thought we like dodged the bullet of the flu
Mhm.
this year, but perhaps we have not. So what are the signs and symptoms that we should be looking out for from a flu standpoint?
So each strand of flu is a little bit different, but typically it'll be fever and chills, cough, sore throat, runny nose, muscle aches is a big telltale sign of the flu, like you just worked out a lot, kind of muscle aches, headaches, fatigue. There are also sometimes GI symptoms depending on the strain. So you can also have vomiting or nausea. So all of those can be because of the flu. They can be because of any virus, but if you have all of those, it's likely the flu.
Okay. And so what is your best advice if you feel like maybe, somebody's starting to like circle the drain a little bit in your family? What do you say? Should we give it a couple of days or do we head into clinic? What's the best practice here?
So I would say go to clinic and get tested so you know if you have the flu. Now, if you have most viruses, you typically just do supportive care. But the flu, we actually have medicines that can help limit how bad your symptoms are, as well as the duration of your illness. So we can't say that about everything, but for flu, for sure, we have something that can do that. So I would say as soon as you start to feel those symptoms, get in and get tested so you can get that medication to help you recover quicker.
Okay. And your flu test, are y'all still like combining the flu and the COVID test together or what does that look like?
They're actually separate now. So we don't do the combination anymore. Back then during COVID time, everybody wanted to know, do they have one of them? Do they have both of them? So now we do them separately because there are distinct symptoms for the flu and distinct symptoms for COVID. So we will test you specifically for the flu if you're within the duration and you have these specific symptoms. And also the treatment is different too. So it's important to know which one you have.
So you mentioned something really important there, the duration.
Mhm.
So speak a little bit to what is the duration on like when like if onset of symptoms and then getting the flu test,
Mhm.
when is it just not valid? And you may have had the flu, but now it's not showing up as a positive.
So typically within the first 3 to 4 days, if you get tested, that'll be an accurate result. But with that being said, it's about a 50 to 70% sensitivity. So if you have all the symptoms and you test negative, it's possible you're in that part that wasn't sensitive. So if you go in and your provider does an exam for you and you have all the symptoms, we can still diagnose you with the flu clinically and give you the treatment, even if that test isn't positive. But if you want that test to be positive, you definitely have to come in within the first 3 or 4 days.
Okay, that is good information to know because sometimes we let them like write it out a little bit. Like,
Hmm.
I don't know. I mean, you guys know I'm a mom of twins and they're 14 and sometimes they'll be like, "Oh, my throat hurts." And it's like, "I don't want to take you too soon because I want the strep test to like pop as a
Yeah.
positive if that's going to be the thing, you know?"
Yeah.
I don't want to miss the window. So you speak
Mhm.
to some of the medicines that y'all can give. What does that include?
Mhm.
I mean, are we talking like antihistamines or other kind of things?
So all that we would do for normal supportive care for viruses for sure, Flonase, antihistamines, but also Tamiflu is very specific for the flu. Tamiflu, if you don't take it within the first 48 hours, it's not even recommended to give to the patient. So if you come in on day 4 and we have you as the flu, we may not even give you Tamiflu because it won't really be effective.
Yeah.
And it's not a cure for the flu, but it can decrease the duration of symptoms and make them a little bit milder as well. There's also Zofluza, which is a newer option within the last few years. So that's just one pill. Tamiflu is 2 pills twice a day for 5 days as a treatment. And then Zofluza is just one pill. So that's kind of a cool option, a direction we're going in. However, it's a little bit harder to find and probably a little bit more expensive depending on your insurance type.
I've never heard of that. Is it tolerated better? Because I sometimes hear things about Tamiflu and maybe like my kids when they were younger did not tolerate
Yeah,
Tamiflu very well.
it can
There
make
was
you
maybe
nauseous.
some projectile
Yeah.
situation.
That's a pretty well-known symptom of Tamiflu and the flu, actually. So we do ask our providers to try to give Zofran with Tamiflu if they're giving out Tamiflu to help with those symptoms. But Zofluza is just one pill, so yeah, I believe you have to be over 12 to take that. But if you're over 12, you can take it and you can find it and pay for it. Then I've heard great things about it. I actually haven't taken that one myself, but I've heard wonderful things.
Oh, that's good to know. Okay, so
Mhm.
speaking of finding all these medications, I remember
Mhm.
last year, and I don't know if it was flu or something, but you could not find, oh, what was the medication?
Was it Bromfed?
Yes, and
Yeah.
they
Mhm.
would prescribe it and it like nobody had it.
Yeah.
So what are we hearing from pharmacies right now as to what's in stock? Are we okay for this flu season or should we prepare to call around?
It's so hard to tell because we're in a late flu season. Because last year, this time, the flu was kind of like on the upswing. We weren't as much worried about it. So I haven't heard of any shortages of Bromfed, but we do try to be very right yet. There may be soon. But we do try to give you just as much as you need for that week so that we're not giving away all this Bromfed that can be used by other people. But there are also a lot of great over-the-counter options for cough. Because we have to remember that the cough is just a symptom that we're treating, right? What we need to do is really treat the virus. So Tamiflu will help do that. And even if you take Tamiflu, it can still take up to 2 weeks to feel 100% better. So with these viruses, you just have to kind of ride it out and do things to make yourself feel better. And even fever, you can take Tylenol, ibuprofen. All those things will just make you feel better, but not necessarily cure the virus.
Just what every mother wants to hear,
Yeah.
right?
I know there's no magic pill. But one thing that's great is that we offer is called the mini visit for the flu. So, for example, if you come in and you're diagnosed with the flu, you're like panicking. All my children, my husband, everyone's going to get the flu as well. So, we can actually just take your husband's information and prescribe prophylaxis for the flu. So it's the same medication, Tamiflu, but you just take it once a day if you're exposed with someone that has the flu and doesn't have the symptoms yet. So that's an
Oh,
option to kind of get ahead of the plan.
yes, because we all do the panicky, like
Yeah,
get all the
everyone's gonna get it.
Lysol,
Yeah.
spray all the things, and you're gonna go be in your room.
Yeah,
Um,
exactly. A divider between us. Yeah.
yeah. No, I don't know what it is about flu that's so scary. It is for me because I'm allergic to eggs, so I can't get
The flu shot.
the flu
Yeah,
shot. So like Dr. Thomas said, obviously we encourage you to go ahead and get vaccinated for
absolutely.
the flu. Do y'all do flu vaccinations?
We do. We do. Yeah. So you can just walk in and get a flu vaccination, whether you're a prime patient, urgent care patient. They're different pricing, but you can absolutely walk in and get a flu shot.
Perfect. And one thing that we put out in an article last week, y'all know we've been partners with Next Level for a really long time, but they recently this past fall went through a great new rebranding. And there's a lot of exciting things on the horizon for Next Level. Um including some pretty new graphics, but also you guys got a new app. How's
Yep.
that going?
We have a lot of improvements in the app. And one of the coolest things is once your visit is finished, as soon as that provider hits submit and submits that note, you can see the note on your app. So you can see the medications you were prescribed, you can see the note. So you don't have to call anybody to get your medical records. Everything is available to you on the app. And you can look at it for yourself, for your children, for your spouse if he allows you to, so you have that availability. And I think as this is 2024, technology is so important in Next Level, and I think we're really moving in that direction to have this available at your fingertips.
Yeah, no, I loved it. And I recently had to use it and it was great and it was
Mhm.
very seamless. You put in your info, it had captured some from a previous but you can go in right there. You can schedule your appointment and mm, go in and have great care within a couple hours. I mean, at least that was my experience. So
Mhm.
remind me how many locations y'all have in Houston now. I know it's so many.
So in Houston, we have 28 total. That's including Beaumont and Nederland. We kind of call that Houston as well. For under me, we have 10 locations. So we have five in the Katy area and five in Central, three in Central and two in the Cypress area as well. But we have
Okay.
everywhere you go, you'll see a Next Level, I'm sure.
And I think that's so important for y'all
Mhm.
to know that if you're not feeling well and you're looking for a place and sometimes our pediatricians get busy and you can't get in same day and we all kind of have that again, like that panicky feeling when your child isn't feeling well. Next Level is a great option for that. They're also in Austin and San Antonio. So if you're
Absolutely.
traveling or if your travels take you over there to the west, and you can find a Next Level over there too. So in the
Mhm.
comments below, I will post a link to their app so you can go ahead and get that on your phone. I encourage you to do it now. Do it before the illness strikes when you're not like all
Yes.
stressed out. Have it ready to go.
Mhm.
So that way you can go ahead and get in line online as soon as you need to if something were to happen. And then we'll pop the link about their new branding and everything that they're doing on kind of like the business side. That's really exciting for all the Houston people. But Dr. Thomas, thank you for sharing a little bit about what you're seeing in clinic. And we are going to just pray that this flu season comes up and then goes right back down, right?
Yes. Yes, quick flu season, absolutely.
Yes. So if it's late, it's got to be quick. I think that's
Mhm.
the rule. Uh,
Maybe.
you're like, no, that's not what the medical say. That's what I'm gonna believe as a mom. But
Uh-huh.
um, thank you again, always for being so generous with your time. Again, we highly recommend Next Level for all of your urgent care needs. They also have on-site X-rays you can get. Um,
Mhm.
if you have a broken bone during sports, you can go ahead and get it x-rayed and get taken care of. They can handle almost anything. They handle back issues too, because I went
Mhm.
2 weeks ago with a back issue and much better now. So um, we hope you stay happy, healthy, and safe this 2025 season. But if not, our friends at Next Level are there for you. Thanks so much. And we will see you again next quarter with another informative health video.